Hello, this is Gordon Johnson from Portland, Oregon, and I'm finding a lot of physicians in training and even practicing physicians are not very comfortable doing LP these days, so I'm going to make a phantom here where you can practice, then you can do it safely and easily on patients. First of all, you want to go online and just buy one of these lumbar spine models, then stick a dowel inside of it down the spinal canal. That'll create a space for your CSF. You'll see why later. Pick up some ballistic gel, and I usually heat this up in a bread pan. I would recommend using a metal one, using a barbecue, and only keeping it about 200 degrees. Do not overheat it. It breaks and makes a big fire. I can speak from experience. After it's melted, just submerge the spine model into the bread pan, and when it's cooled, pull it out, and slowly pull the dowel out like this, and that'll create the space there where you can put in your CSF fluid. I used a Penrose drain here, but you can also use just a regular balloon and tie the end of the Penrose drain and then use a chopstick there. It's good to put a little grease on the chopstick and the outside of the balloon or the drain just so it slides into that spinal canal really easily. And once it goes through, you use your other hand then to just pull the chopstick out, and you have it on both ends. So just fill it with some water. You can do it from the tap or with a syringe like this repeatedly, and tie it off, and you're done. And you're ready to do your LP. So you can use the landmark method. I'll show you how to use ultrasound after we get done with this. So just feel the spinous processes. Again, the more gel you have between the model and your finger, it's more like an obese person, so you can make it more difficult just by not submerging the spine model so deep within the gel. Obviously, you want to use sterile gloves if you're doing this for real. And slowly just angle it in just above that spinous process there, right in the midline. And you'll feel the pop of the balloon of the Penrose just like with the Dura. And you bring the stylet out, and there you go. There's your CSF. It's that easy. So next we'll do it with ultrasound here. And here you're going to start in the transverse position. And you want to get the spinous process just exactly in the midline of your screen, like this. There's the dome of the spinous process. And after you do that, being real careful, keep your probe steady, put a line right in the middle of your probe, on the upper side and the lower side, but it has to be right in the middle. And let you know where your midline is. If you've got a very obese patient, you can't get landmarks. Now here you are in the longitudinal, and you'll see the two spinous processes on the side there. Now there's a lot of artifact in this gel, but that makes it more realistic. And again, keeping it steady, right in the middle of your probe, also make two horizontal lines. And then when you remove your probe, you just have to extend those lines, and that will tell you exactly where that interspinous space is. You can certainly practice this on your colleagues. So here's a guy celebrating after he did a successful LP, practicing many times on the phantom. This guy's jacked. He did it safely, painlessly for the patient.